Well, for more, I'm joined now by Dr. Derek Gatherer from the Biomedical and Life Sciences Department at Lancaster University. Thanks so much for speaking to us, Doctor. From what you've seen and noting the action the WHO has taken already, just how serious is the risk that this could spread to even more urban areas?
Good afternoon. The risk is fairly substantial because many of the events we've seen over the last week or so are reminiscent of what we saw in West Africa in 2014. We started out with a handful of cases in a relatively remote rural location, then we saw spread to the local regional hospital and then spread on to a large city, Ben-daka, which is in fact a port on the Congo River and has extensive river traffic with Kinshasa, the capital of the DRC, and also upstream to Bangui, which is the capital of the Central African Republic. So we're seeing many of the same things that we saw in the early stages of the West African outbreak in 2014. So it's really important that we stop this thing as soon as possible.
It is important, but what, if anything, can be done to actually stop its spread?
We have the advantage this time round that we have the vaccine available. So 4,000 doses of vaccine are now in the DRC. The World Health Organization has identified 432 official contacts of affected cases as of this morning. So they'll be first in line to get the vaccine. It'll be a ring vaccination campaign. First vaccinate the contacts and then vaccinate the contacts of the contacts. And with a couple of rings of vaccination around the affected individuals, hopefully any transmission chains will be cut short. Healthcare workers will also be vaccinated. The primary reason for that is because we know, especially from our experience in West Africa in 2014, that an infected healthcare worker can be a super spreader because they're moving among patients in hospitals. So it's important that they get vaccinated as well in the first group.
Now, as for the West African experience, how is it that West African countries were celebrating Ebola's eradication just a few years ago, and now it's raising its head again just over in Central Africa?
We don't really know what happens to Ebola virus between outbreaks. It's believed that possibly the reservoir is bats, but unfortunately one of the disappointments of the 2014 outbreak in West Africa was an extensive investigation around the first site of the appearance of the disease in Guinea failed to identify any bats that were carrying it. So consequently we don't really know what the animal source is, and until we've identified that, we don't really know where Ebola goes between outbreaks in humans, and so the question of preventing further outbreaks is rather depressingly one that we probably can't address at the moment.
Okay, Dr. Derek Gatherer, we'll have to leave it there. Thanks so much for speaking to us as always.
Thank you.